So ACE is a social enterprise. We cover the whole of North East Essex. So when I took the role over about 3 years ago, there was lots of changing of visits, moving of visits, cherry picking, and I discovered that I had band 6 nurses doing a manual scheduling.
It was really hard work. It was very frustrating, spending hours allocating the work, getting the right people in the right place at the right time. It was just really frustrating because we needed to be out on the ground doing the work that we're trained for, and we were spending time doing admin work.
And visits with the old system were getting deleted, and patients were having missed visits.
So some of the problems were caused by missed visits, so the district nurses actually failing to attend a patient visit. This led to things like missed insulin visits, missed visits around pressure ulcer care, which could result in a fine of £10,000 per pressure ulcer, and in one financial year were racked up fines of £120,000.
Something had to give. This problem was only going to get worse. We needed some sort of technology to help with this scheduling problem, but there was nothing out there. That's when we came across Malinko. They were already solving problems of logistics in the commercial industry, so we invited them in.
When we first came to ACE, we brought with us what we thought was a good technology with our experience in scheduling, but then we realised actually there was a lot more to it with the community services. A lot more kind of clinical rules, and you have to be more patient focused. For example, each patient is very individual, so the duration of visit based on acuity may not work kind of across all patients. You have to be flexible, and some visits may be longer for certain patients. Also around insulins, that was very important to make sure you don't put anything in between insulin. So lots of little things like that. With a human, they would know that straight away. We have to teach the system to learn that.
Now, via the real-time dashboard, we can now see where our nurses are at any given time. We can see if any emergencies come up, like SOS calls or through sickness, staff sickness. We can make swift adjustments at any given time. And at a glance, we can look at key indicators such as insulins and flagging any issues.
So when we introduced Malinko, I think it's fair to say it was a big change to the way we operate in terms of our nursing teams. So there was a lot of resistance from the nursing, and most of them saw it as a big brother kind of approach, that managers wanted to be watching where they were and keeping track of them. But we took it ourselves to listen to the staff and get their feedback. And now most of our staff are very positive about the system.
So the new system is great. Everything's just on the phone. You don't have to load up your laptop. Saves a lot of time. We don't have to allocate any visits, so it's all done on the computer.
So what I love about it is the fact that the patients are listed on my phone, and they're listed geographically, so I know exactly which route to take. So because I've followed it geographically, my list is done quicker, so I've done visited my patients a lot quicker.
We're 2.5 years down the line. I've not had a single missed visit. I've not had a single pressure ulcer fine. I know where my nurses are. I can quickly deal with anything that happens within the team. So like sickness, I can reallocate visits easily. SOS visits, your stat doses, your blocked catheters. We've now rolled it out to all 4 localities. At a touch of a button, we're allocating approximately 6,000 visits per week. Moving forward, there's a number of key areas that we're working on. Deeper integration with our clinical system, e-expenses and automating that, an acuity and discharge planning tool within Malinko, and electronic off-duty management. So what started as a scheduling tool has now added strategic value to our organisation, and ultimately it's got our nurses back to nursing.